Dr. Wallace, thank you for joining us. A very timely topic. We're talking about Ebola, which has come to the United States from Africa. When we talk about Ebola, let's just get very basic. Where specifically did the Ebola virus come from? What makes it such a deadly disease?
We know where it comes from geographically, but we still don't have a good handle on what the reservoir is. We think it's likely to be something like bats or small rodents, because other members of the same viral family as Ebola, that's the reservoir, then somehow people come in contact with that, and then they develop disease, and then it spreads person to person.
Why is it so deadly? What is it about this particular virus?
It belongs to a family of viruses called the hemorrhagic viruses. That name alone should tell you this is not a good disease. There are 4 or 5 of those. Most of them are in Africa. And most are just associated with very severe disease, often ending with excessive bleeding, bleeding in the eyes, bleeding in the skin, and then death. So that all of them have a very high death rate. And in many ways, we're fortunate that it's very isolated in terms of where the disease has occurred. And obviously, we've never seen it in the United States, and most other countries haven't seen it either.
Now, we're told by the Centers for Disease Control we can only get sick from the Ebola virus if we come in contact with a person, I'm going to quote here, direct bodily contact with the fluids of an infected person. That seems obvious, but what exactly does that mean?
Most of the viruses that we worry about are respiratory viruses. So you see people wearing masks, and so protection really is relatively easy. If you wear the appropriate mask, you're not going to breathe in the virus. It's a different virus. There are no respiratory symptoms generally with these patients, but they get nausea, vomiting, and diarrhea. And the vomitus and the diarrhea are heavily infected with the virus. So simply touching those fluids and then either contacting a break in the skin or putting your hands in your mouth, and you have the disease.
We say it's not transmissible by air, it's not respiratory. Is there any possibility, or even likelihood that the virus could mutate and become transmissible by air?
That's always been a concern for a number of viruses. It's possible, but probably not very likely. And I'd have to say it's doing a very good job of transmissibility without being a respiratory virus. I mean, we're having a very difficult time controlling the disease, especially in Africa, but we've already had cases in Europe in which there has been person-to-person transmission in Europe. So the likelihood that we'll have difficulty here is the same. So it's very effectively spread by that mechanism.
Ebola's been around for a while. Why don't we have a vaccine for it?
It's not a very common disease. And most of the outbreaks have been small, so it doesn't excite a lot of energy in the scientific community to make a vaccine. Now, having said that, it belongs to a family of viruses in which there are no vaccines. There are different kinds of immunity. Some of it relates to particles in the blood called antibodies. Mm-hmm. There are a large number of vaccines. The pneumococcal vaccine for the pneumococcus, the H-flu vaccine, have almost eradicated those diseases because the vaccine makes antibodies, and antibody protects them. Antibodies does nothing to the Ebola virus. It requires cellular immunity. It requires specialized cells that learn to kill the virus. So finding a vaccine that stimulates cells to kill the virus has been very difficult. Let me give you an example. The HIV virus requires cellular immunity to kill the virus. We are $5 billion and 25 years down the road, and we still don't have a vaccine. So although the viruses are different, they do belong to the family that require specialized cells to kill the virus, and how to stimulate them with a vaccine has pretty much escaped the scientific world.
Well, I think you've just answered the next question. How long will it take to develop a vaccine? And the answer is
A long time.
long time. Okay. Since the time from Ebola exposure to the onset of symptoms is from 2 to 21 days, what benefit is there in taking temperatures of arriving passengers at major airports, for example, as has just begun?
We, we believe that patients who are not ill, meaning they don't have fever, they don't have aches, chills, vomiting, diarrhea, are not contagious. So if they have no fever, they're not likely to have any of those symptoms, and they're not contagious. So they step off a plane with 350 people on that plane, and they don't have a temperature, then we know that there is almost no risk for the individuals there, because it's the body fluids, the vomitus and the diarrhea, that spread the disease, and they don't have it. It doesn't protect us from when they develop the disease later and no one knows what that disease is. Now, a big question is going to be, okay, fine, we can identify people either when they got on the plane or they get off the plane who are sick with the disease. How do we identify those people at high risk and prevent exposure to other people in the US, for example? We've used quarantine in many years ago, in years past, when we didn't have antibiotics and ways to control things. So we had places that people went while they stayed for the incubation period of the disease, and if they didn't become sick, then they were allowed to go free. We actually do this with animals and birds. For example, citizen birds, parakeets and whatnot, get a disease called Q fever. So we incubate, we put those birds in isolation for the incubation period of the virus. If they become sick, they're euthanized, and if they don't become sick, they go on sale in your local pet shops. The likelihood that we will have to institute some form of isolation for people who are at high risk, they came from a country, they were exposed to the virus, is almost certainly going to happen. Now, how they do it and what the mechanism is, but it really is the only way to protect you if a patient steps off the airplane, been exposed, didn't necessarily give you a good history, but is not yet sick, which is exactly what happened with the patient in Dallas. And because no one knew how to protect themselves, he exposed virtually everybody in the family and all the friends who were helping to take care of him.
During the summer of 2014, the two missionaries that we heard about, U.S. missionaries, transported back to the U.S., they were treated and they lived. Why did the Dallas patient Thomas Duncan die?
In Africa, we know that the mortality is about 50% if you don't do anything. So 1 out of 2 patients die. That's still an incredible death rate if you consider the viruses were around. Influenza, hepatitis. I mean, they're generally not lethal viruses. So this is a particularly lethal virus. But many people do survive. Many people have a mild form of the illness. Right now, we have no idea why. It is probably genetically determined. Some of them have those specialized cells that quickly learn to fight the virus. And some of us just don't have the right genes, very susceptible to the virus, and we end up dying. He probably had those genes which did not provide him any protection at all.
List of things that, viruses that are bad news for us. These dangerous diseases, infections, where are they coming from? First it was the swine flu or H1N1, now the enterovirus D68 that school children are getting, the chikungunya virus in the Caribbean and South America, and now Ebola. Why all of this now?
Many of these viruses and bacterial diseases have probably been around for thousands of years. They were localized in where they cause disease because of the habits of the people who are around them. We believe that HIV was actually already prevalent in Africa, possibly in primates for who knows how long. But we have some evidence going back 40, 50 years that it was least around back then. But the people changed their habits. Instead of staying in little localized villages, so someone who got HIV died, didn't necessarily transmit it to everything else. We built the Kinshasa Highway, main city in Africa. All these people from these small towns now migrated there to buy things, to sell things, and they took advantage of some of the lifestyle that goes with a big city, and that turned out to be a very effective way to transmit HIV, and then it was spread worldwide. So here's a disease that was probably around, we really don't have a way to test how long, but we suspect it's been there maybe even thousands of years. But we changed our lifestyle, and that lifestyle contributed to increased exposure of individuals. Now, that's one factor. Another factor is world travel. I mean, you couldn't get an airplane from one of these 4 countries where we now have Ebola to almost anywhere in the world. Now you can step on a plane, you can fly to 25 European cities, and from there you can fly everywhere in the world on any given day. And probably hundreds, maybe even 1,000 people leave these 4 countries every day. And so world travel and the ease of world travel have just expanded the horizon for all these infections who've really been controlled by local customs and the localized nature of patient or people populations, which almost no longer exists anymore. I mean, we talk about populations of people that have never been exposed to the modern world. There aren't many of those left. But 25 or 30 years ago, it was not unusual to have many tribes in Africa, South America, that basically had never seen a white man. It doesn't exist anymore. People are in and out, they want to take pictures, they want to visit, and we bring disease to them. Think about how smallpox was spread to the Western Hemisphere from where it resided in Europe for hundreds and hundreds of years, and we traveled over here and we brought it to people who had never seen it, and they died by the thousands. Well, we also pick up diseases from them, and each of the diseases you mentioned probably has existed for thousands of years, but because of the change in our lifestyle and how we travel, we're bringing those diseases to susceptible hosts.
Ebola's been around Africa for quite a long time, but all of a sudden it seems like we have an acute outbreak going on. Why? Why now?
I'm not sure we have a good answer why outbreaks for this virus occur. We don't know a lot about it. There have been a small number of outbreaks in the past, but not many people have been around it, not many people have studied it, so there's a lot that we don't know. Now, most of the outbreaks occurred in just a small number of African countries. This Ebola outbreak, for reasons that are not clear, has occurred in 4 countries that have never seen Ebola. So the healthcare personnel, the people have no knowledge about how to protect themselves, what to do with the virus, as opposed to areas of Africa that may have seen 2 or 3 outbreaks. We're already kind of prepped for them in terms of getting them the kind of protection that they need, in this case, personal protection with gloves and disposable gowns, bringing all the people in the hospitals. We didn't have any of that. The people that lived in Uganda and Liberia didn't have any experience with it. So they died in droves before we figured out what the disease was. And now we're trying to teach the people, how do you protect yourself? I actually was a missionary in Liberia about 10 years ago. And when I was in the small hospital that is there, in the pediatric ward, for example, the mothers were responsible for washing, feeding, dressing, and taking care of their child because we had no one in the hospital to do it. So we'd come in the morning, and here would be the child if he was well enough to sit up, and here was mom all dressed up. She'd done everything to get him ready. So families take care of sick people in Africa, even in the hospitals. It's the worst scenario for this virus because they have vomiting and diarrhea. They don't have gloves, they don't have gowns. So they contaminate the entire family that takes care of those patients. And they all get sick, and then whoever takes care of them, we go through the same scenario over and over again. We also say it's not likely to be that big a problem in the US because we have available supplies, because our normal isolation procedures for someone who's vomiting or has diarrhea is to wear gloves, to wear a disposable gown, to wear a face shield that protects you against if they happen to vomit while you were there. So the risk to those individuals is very small compared to what happens in Africa. It was just terrible scenario in a country that was unprepared for the poorest countries in Africa with almost no health care. It was almost an invitation to a disaster, and that's what happened.
Well, so then bottom line, and I think you touched on this, how likely is an Ebola outbreak in the United States comparable to what's going on in West Africa?
I think it's not very likely, and the reasons are the same. We're a very educated population. We understand how the disease is transmitted. We understand the importance of isolation. We understand the importance of putting people in the hospital or putting them in the isolation when they get sick with a specialized group of people who care for them, who know how to protect themselves and have available to them the materials that are needed to protect themselves. And those materials, they're not available in Africa. They still don't have enough there, and the reason you still see missionaries and doctors getting sick is they don't have the gloves and the gowns and the stuff that we need in those countries to protect themselves. And obviously the people who are there aren't able to protect themselves. So I think the likelihood of that disease causing a similar disease in the US is highly unlikely. But people who slip into the country and don't tell people what's wrong with them, and their family takes care of them when they get sick, they are at risk. And it would not surprise me if a number of this patient in Dallas's family came down with the disease because they didn't protect themselves at all against the way the disease is transmitted.
Well, so doctor, then finally, how do we separate what we need to know about Ebola from the media frenzy?
Not easy, because this is a really bad virus. When we say 50% of the people die, well, we don't have many diseases that are associated with an acute illness in which that many people die. So, I think it is important that people be aware of the changes we talked about, which means because there's an outbreak in Africa, they can say, oh, it's in Africa, I'm okay. Not so. They need to understand that these people can end up in Tyler. For example, Smith County, Gregg County has a large number of missionaries, most of whom go all over the world. Many of them are medical, but also dental, nurses. What are the odds one of them are going to end up coming back to Tyler or Longview? Actually, it's very good, in my opinion, because we're nowhere close to solving the outbreak in those countries. Now, once we start to get isolation and we have adequate materials and equipment over there, it'll be different. But I think there are a lot of people who are afraid to go there. And some physicians that I've talked to from here, same thing. I would go, but I'm afraid they don't have enough equipment to protect me, so it's not time. It's not time for me to go. So they need to know about the disease. They need to know how to protect themselves. They need to know if they do the right things, ask the right questions, you'll identify who's at risk to having Ebola, and you would know what you needed to do to protect yourself. And maybe it's what we do for Ebola should be done for any family. If you have somebody in the family who's vomiting and has diarrhea, you don't use your bare hands, and you put gloves on, and you may put yourself something on that you can wash and clean yourself with. Maybe that's a good general principle. We practice it in the hospital, but we probably don't practice it at home, and they certainly don't practice it in Africa for financial reasons more than anything else. So maybe there's a lesson for all of us to learn here. So it doesn't matter if it's Ebola or some other enteric disease, then we'd be protecting ourselves and our family members from getting sick.
Very well, doctor. Very, very informative. Thank you so much for your time.
You're welcome.